Hi, I'm Dr. Mike. In this video, we're going to be going over some of the things we talked about in terms of the cervical spine, which is the neck area, and focusing more on some of the problems that can occur that we commonly see here, and problems that can occur to your neck. One of the more common ones that we had talked about is a reversal of the cervical curve. Normally, we should have a nice sloping curve to the back of the neck, and that curve can reverse for a number of reasons. It's called a whiplash or a hypocervical curve, and very common nowadays, both from car accidents and also from the positions that people tend to have their heads in, looking down at their cell phones. If their computer screens are too low, the head tends to be pushed forward, which tends to cause a loss of that cervical curve over time and can lead to problems with neck pain, pinched nerves, as well as disc compressions. The other thing that tends to happen very often is a problem called cervical stenosis. What cervical stenosis is, essentially, is a narrowing of either where the spinal cord comes through the center of the neck, called central canal stenosis, or a narrowing where the nerves are exiting from the spine, which is called foraminal stenosis. On MRI, if we look at an MRI, we can see the spinal canal, and we can also see the nerves and the cerebral spinal fluid that flows around the spinal canal. So an MRI is actually a great tool to look for cervical stenosis because you can actually see what the spinal cord looks like and whether it's getting crimped and whether it's narrowed, and whether that narrowing is being caused by various things such as discs that are protruding into that spinal canal, or sometimes the facets can start to hypertrophy, get larger, grow scar tissue that can push into the spinal canal, and that's called central stenosis. An example here shows you what central stenosis looks like on an MRI. Kind of symptoms that people can have in central stenosis can vary depending on what part of the spinal cord is being compressed, but those can vary anywhere between the arms and hands getting numb, loss of strength in the fingers, difficulty moving the arms. And the other thing to consider is because the spinal cord is basically bringing nerve impulses and turning into spinal nerves lower down, a person with cervical stenosis can also experience problems in other parts of the body as well, even down into the legs. Because again, if we're getting a crimping that's going on in the cervical spine, then because that cord is going all the way down into the lumbars and all the way, the nerves are progressing all the way into your legs, then that can actually affect other parts of the body as well. Here's a case here that you can see on this MRI where the cerebral spinal fluid is not getting to the outside of the spinal cord, and you can see how it's very narrowed. This gentleman came in, he was referred to a neurosurgeon. He was losing feeling in his hands, losing grip, as well as having a lot of pain in his arms. So essentially he came in where the only position that he was comfortable in was to have his arm up over his head, which made it difficult for sleeping and for getting into any position where he had to use his arm. So essentially that arm, the only thing that would relieve it was having the arm up. Luckily, he did have an MRI that we reviewed, and we could see very clearly on the MRI that he was getting stenosis in his mid-cervical area. We actually worked on him using special chiropractic techniques involving not a twisting motion in the neck, but a motion to reposition the discs called a drop cervical adjustment. And usually that adjustment will help to make room, if there's enough room to maneuver the discs into a better position. In his situation, it provided close to 90% improvement, and he did not need spinal surgery. So that basically with cervical stenosis, oftentimes we can help. There are times when people do need surgery, particularly if there's instability. So what instability is where the vertebrae are moving from front to back with motion in the neck. So typically the way that we would check for that is we would do cervical x-rays, and with those x-rays we would take the patient into a flex position, we would take a picture, in extended position we would take a picture, and we could also take a picture with the head moving into a right extension and a left extension position. What we want to look for with these films is whether we have anterior or posterior movement. These x-rays that I'm showing you right now are x-rays that indicate instability in the cervical spine, meaning that as we move the neck, those vertebrae are moving in an anterior posterior dimension beyond what is considered normal. So these are just a couple of problems that can occur in the neck. In the next video we'll talk about what's typically called pinch nerves, where the nerves get impinged upon at the level of the intervertebral foramina, which we call the IVF, which is where the nerves are exiting from the vertebrae, between the vertebrae, to go to the different muscles and different parts of the extremities. So I hope you enjoyed this video. If you have any comments or questions, please leave them below, and remember to share and like, since we really like when you do that. The viewing of this video podcast is for general information only. It does not constitute the practice of medicine, chiropractic, or any other healthcare services, including the giving of medical advice. No doctor-patient relationship is formed or implied. Please subscribe, like, and share if you find these podcasts useful.